If you or someone you love has recently been diagnosed with breast cancer, we know it can feel like your whole world has turned upside down. The goal here is to just walk through the treatment options in a clear, simple way to help you feel a little more prepared for the road ahead. So let's get started. And it's completely 100% normal to feel that way. I mean, there's just so much to process, right? It's like you have to learn a whole new language overnight, all while making these huge decisions. You begin right here, just by building a solid foundation of knowledge. We're going to break down the main types of treatment so you can really get a handle on what each one does. First, we'll get a big picture view of the treatment roadmap. Then, we'll dive into the main categories, starting with local treatments like surgery and radiation. After that, we'll talk about drugs that work throughout the body, like chemo, and then get into some really advanced therapies. Finally, we'll see how it all comes together to create a plan that's made just for you. Okay, so first things first, let's get that bird's eye view of the whole landscape. You have to know that doctors have this really powerful toolkit with a lot of different ways to fight breast cancer. And all those tools fall into a few main categories. Now, some of them work on a very specific spot in the body, while others kind of work system-wide, traveling everywhere. Understanding that basic difference is so important because your doctors will often use a combination of these to build the best plan. All right, let's open up that toolkit and start with the first set of tools, local treatments. And just like the name says, these therapies are all about removing or destroying cancer cells in one specific targeted area. We're talking mainly the breast and the tissue right around it. Surgery is very often a primary step, and there are two main paths here. First is a lumpectomy, where the tumor is removed along with a little bit of healthy tissue around it, just to make sure they got everything. The other path is a mastectomy, which is when the entire breast is removed. Sometimes the surgery can be a bit more extensive, maybe including nearby lymph nodes to check if the cancer has started to spread. Now, radiation therapy often comes in right after surgery. Think of it as a cleanup crew. The goal is super simple. Use powerful, really targeted energy beams to either completely destroy any leftover cancer cells or just stop them in their tracks so they can't divide again. So how is it done? Well, there are two main ways. The most common is external beam radiation. That's where a big machine outside your body aims the energy with incredible precision. The other way is internal radiation. It's also called brachytherapy, where a tiny radioactive source is placed right inside the breast, right where the tumor was, for a short time. Okay, let's shift gears. We've talked about local treatments. Now let's move on to systemic ones. These are drug therapies, and the key thing to know is that they travel through your bloodstream. And what that means is they can fight cancer cells pretty much anywhere in your body. And the first one you've probably heard of is chemotherapy, or chemo. This uses really powerful drugs that are designed to hunt down and kill cells that divide rapidly. Since cancer cells divide way, way faster than most of our normal cells, they become the main target. And because these drugs go everywhere, they're great at fighting any cancer that might have spread beyond the breast. Now, this next therapy is fascinating. But to really get it, you have to understand this one key fact first. Some breast cancers are clever. They've actually figured out how to use your body's own hormones as a personal fuel source to grow and spread. The main hormone we're talking about here is estrogen. For cancers that are known as hormone receptor positive, estrogen is like pouring gasoline on a fire. It literally feeds the cancer cells and tells them to multiply. So, what's the solution? Well, you cut off the fuel supply. That's exactly what hormone therapy does. These drugs work by either getting rid of estrogen in the body or by physically blocking it from attaching to the cancer cells. You're basically starving them. All right, let's move on to some of the most advanced and, frankly, brilliant treatments out there. These therapies are all about using your body's own specific biology to fight cancer in a much smarter, more sophisticated way. So here's a perfect example. There's a protein called HER2. Some breast cancers just make way too much of it, and that extra HER2 acts like a gas pedal stuck to the floor, making the cancer super aggressive. Well, targeted therapy drugs are like smart missiles. They are engineered to do one thing and one thing only: find and lock on to those HER2 proteins. Once they attach, they shut down the cancer's growth signal, and they do it without really bothering the healthy cells. Now, for our last treatment type, immunotherapy, we have to talk about a little problem. See, your immune system is an amazing cancer-fighting machine, but some cancer cells are sneaky. They've developed ways to put on a disguise, to become invisible and just hide from it. And one of the ways they hide is by using something called checkpoint proteins. You can think of it like a secret handshake. When a protein on a cancer cell connects with a matching one on an immune cell, it sends a stop signal. It's basically telling the immune system, hey, I'm one of you, nothing to see here, just move along. This slams the brakes on any immune attack. So what immunotherapy drugs do is act like a blocker. They get right in the middle of that secret handshake and prevent it from happening. By blocking that stop signal, the brakes come off, and suddenly your immune system is free to recognize the cancer cell for what it is, a threat, and destroy it. It's like taking the camouflage off the enemy. Whew, we have covered a lot of ground. So how do all these different pieces, the surgery, the radiation, the chemo, these advanced therapies, how do they all actually come together? And this right here is probably the single most important thing to remember. Treatment is almost never just one thing. It's not an either-or choice. Your medical team is going to look at every single detail of your cancer, its size, its type, its unique biology, and they will create a personalized combination of these therapies, a plan that is designed just for you. So let's just quickly recap the big takeaways, right? First, there are many, many powerful ways to treat breast cancer. We've seen how some are local, like surgery, and others are systemic, like chemo. We've also learned how these advanced therapies can use your own body's biology to fight back. And most importantly, your treatment plan will be completely unique to you. The whole reason we went through all this was to give you a clear framework. Understanding these options isn't about you having to make all the decisions alone. No way. It's about empowering you so you can walk into that doctor's office and have a better, more confident conversation and be a true partner in your own care. So we'll leave you with this question to think about. Now that you have this foundation, what is the one question that feels most important for you to bring to your next appointment? Because being prepared, that's your first real step forward.